In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
To learn more about psoriasis, I'm talking with Dr. Ludwig-Peitsch. Here, you're head of the dermatology department in this clinic.
Yeah.
Thanks for inviting me today.
Yeah.
You're really fighting against psoriasis. So what changed in the strategies of the therapy over the last years?
So in the last decades, the treatment of psoriasis has changed a lot because a new class of substances has been introduced for treatment. They are called biologicals, and these are monoclonal antibodies or receptor antagonists which target inflammatory molecules of the psoriasis directly. And these are treatments which cannot cure psoriasis, but they are highly effective.
So they modify the immune response in psoriasis, or what do those drugs do?
Yes, they modify the immune response by antagonizing key cytokines of the psoriatic inflammation.
And which patients do you subscribe those drugs?
So first of all, you check how severe is the psoriasis and how bothersome it is for the patients. If patients have only mild psoriasis, they usually go well with topical treatment. However, if they have moderate to severe psoriasis, topical treatment and also phototherapy is often not sufficient.
So phototherapy is treating with light?
Phototherapy is treating with UV light. For example, narrowband UVB, which is also effective in reducing the inflammation of the skin. Yeah, and you have then you have traditional systemic agents which you take orally, and you have the biologicals. The biologicals are approved for moderate to severe psoriasis, and they are sometimes more effective than the traditional systemic agents, but they are also more cost intense.
But isn't it dangerous to modify the immune system and to suppress the immune system to get rid of the inflammation on one hand side, but the other thing is if you would slow it down, the immune system, what about infections?
One of the major side effects of biologics is that they can cause infections. Most of these infections are mild, for example, as nasopharyngitis or upper airway infection. But rarely also severe infections can occur.
We have a patient with us today. Hello, madam.
Yeah.
Thanks for joining us. And you're treating her topically, so with a cream, or what is it? But those are not biologicals, are they?
This is a cream which causes an irritation of the skin, and by this irritation also downregulation of the inflammation. And this cream has been introduced into treatment of psoriasis already at the beginning of the 20th century, so more than 100 years ago. Yeah.
But the patient is not creaming herself with the cream. There's a nurse helping. Mm-hmm. So why is that? Why can't you just take the cream at home? The
cream is irritating for the skin, and this is why the concentration has to be increased gradually. You start with a very low concentration and you increase step by step as tolerated.
Is there a chance that you can cure psoriasis in the near future?
You will not be able to cure psoriasis in the near future. However, you are able to treat it quite effectively, and we are able to find suitable treatment for the vast majority of patients.
We got a viewer question from Natzak Guantala, and she wants to know what can she do as a patient to treat herself and to influence the disease next to the doctor.
So what is important is a healthy lifestyle, because psoriasis can be associated with comorbidities. For example, patients with moderate to severe psoriasis have an increased risk of diabetes and of cardiovascular disease. And this is why they should do sports, they should take healthy food and take care not to be overweight, and avoid smoking and avoid drinking too much alcohol. And then it is essential to use moisturizing skincare, for example with urea, to keep the skin soft and smooth. And in addition, avoid stress if possible.
Thank you, Dr. Ludwig-Peitsch, for inviting me today into your clinic.
Thank you very much.
And thank you that we could join you today. Thank you so much.